Hi, everyone. I'm Vic Gatto. I'm one of the co-founders of Jumpstart. Excited to show off our investments from last year, Q3 and Q4. And so welcome. This is Jumpstart Foundry's first look. And I'll do a quick little introduction of us, and then we'll get to the main event, which is showing off these great innovations and what they're building. Okay, so Jumpstart Foundry, many of you know, we're one of the largest, and I think we're the most active early stage healthcare investment firm in the US. We invest 4 times a year, and we're showing off the last 2 quarters today. Next slide. The team, I'm founder and chief investment officer here. Kristen DeVita runs our founder support program, which is called Jumpstart Insight. And then Courtney Collins, I don't know if she's on today, but she's a senior associate across all of our funds, really sort of advising the companies on how they can grow, raise money, find new sources. We are accepting applications. We're always accepting applications, but at JSF.co, you can see the application for Q2, which is what we're running right now. And it's a pretty quick application. We ask for some information, and then we sort through it and contact you from there. So please apply. I know several of the companies today sort of watched these things upcoming. You kind of learn a lot, and then we'd love for you to submit your application. We also, go to the next slide, we also are publicly available for accredited investors to invest with us. And same thing, go to jsf.co is the website, and you can see the link to become an investor or to apply on that same website. And so with that, we will start getting into the companies. And the first company is ABS Technologies, and I'm happy to introduce Michael Sowers. Michael, the floor is yours.
All right, we are Advanced Biosimulation Technologies. Michael Sowers, incoming CEO. We're very excited to show you our InView platform that we've built. Stroke is the second leading cause of death and disability in the world. Of the 15 million people that this is affecting, 2/3 will either succumb to death or be permanently disabled. 25% are going to miss their treatment window. Obviously, all that has a huge drag on the healthcare system on top of personal loss. We've built a team of MD, PhD, MBAs that have been lifelong researchers in this field and teamed up our business side with disruptive medical device and SaaS personnel that are allowing us to take this into the market and disrupt things that are going on. We have built the world's first individualized stroke care platform that allows physicians to look at patient brain tissue viability in real time. We are a personalized, precise prediction, prevention, prognosis machine. What you're seeing here is revolutionary detail that the physicians that we've showed this to or have used it have never seen before. They're telling us that this will allow them to get the right area of the brain, the right spaces around the brain to safely and effectively treat these stroke patients and make sure that 2/3 number of 15 million goes way down. This will allow them to see exactly what's going on in real time to make sure that this patient doesn't have a subpar outcome. It's easy to use. It's easy to integrate. We're not disrupting workflow. This will attach to a workstation. The imaging modalities they already have. This will reduce costs to the hospitals and payers. This will reduce costs to the patients. And they will also not have to go under additional radiation that is also costly to them. This will support their clinical decision makings on the physician side and enhance it. We will save lives and then give help to these stroke patients. We've been validated globally, not only the hundreds of physicians we've already showed it to. We just finished up a retrospective trial at Asclepios Clinic that will be published next month. We are embarking right now on an academic institution here in the States that not only is going to show the viability and the capabilities of the platform, but also the business side ROI for the hospitals, which we're really excited about. Our brain gut connection was just published in Ciencia last month, and they're publicizing that for us right now. And we currently do have our first customer in Michigan right now. We're attacking a $750 million market. We're only asking for $5 million to make sure that we can enhance this platform, to make sure that it's easy to use, it looks pretty, that will also allow us to rapidly commercialize this product within the stroke field. It'll help us get with the right lawyers and the right consultants when it comes to patents and the regulatory part of it, and really make us understand which strategic partnerships we can go after with imaging companies, pharma companies, and med device companies that we're actually finding out that could be helpful as well. This will be jet fuel to help save lives, save millions of dollars in healthcare, and propel drug development, and maybe help somebody you know.
Great. Thank you, Michael. That was
Thank
excellent. Next, we have AskSAMIE with Dr. Brandy Archie.
Hi, everybody. My name is Dr. Brandy Archie. I'm an occupational therapist, but this is about Kayla. Kayla is 40 years old, one of our clients, and working full time. And suddenly she's the caregiver for her dad, who's coming home from rehab. And they know they need grab bars and equipment, but they are having trouble finding an organization that can help. Now, her dad is surrounded by experts. They are in Metro Atlanta. He's in the hospital, yet they don't have an answer to this vital question. They did tell her what he'll need, but not where it goes, where to get it from, what kind are best, and oh, get it quick because he's discharging in 2 days. Kayla's story is indicative of the larger problem, which is older adults like her dad want to stay living at home. And actually, a lot of solutions exist. But knowing what you need for your unique situation is really a challenge. And the communication between the clinicians who know and the decision makers is not easy. So we solved that at AskSAMIE by providing an on-demand access to clinically based guidance, and not just general recommendations like pick up your throw rugs. Our AI allows Kayla to purchase equipment, connect with services, and find resources all unique to her dad's needs right within the platform. Now, we do that through a dual-sided marketplace where Kayla can get answers for caregiving from SAMIE, our AI, which includes being able to connect with an occupational therapist if she has some specific questions. We currently generate revenue as a reseller of the equipment that Kayla might buy to make the home accessible. But on the other side, we're going to start serving occupational therapists next month with the people who are on our wait list. This is a SaaS model where their subscription gets them business-in-a-box tools plus access to clients. Now, 52% of our current sales come from unpaid organic search, while the rest come from healthcare referrals. So our plan to scale includes strengthening our SEO with expanded content creation, but we're really leaning into OTs as our primary referral partner. So those business-in-a-box tools are also going to soon to include a community, which will make us a repeat top-of-mind place for OTs who encounter dozens of family caregivers every week. And that's really important and noticeable in our traction because since our launch last year, we've had a ton of it, over 600 orders and 10x year-over-year growth. We've also closed the first part of our raise, which gives us the tools to grow our OT platform called OT Connected from its current waitlist to 1,500 users by the end of the year. We have an unfair advantage as a team because we're so much experience with this problem, over 50 years combined. And I have started a private practice, so I intimately know the struggles OTs are going through to grow their businesses, as well as the stress that family caregivers feel. Now, our team is great, but we are always looking to add to our fold. So if you are in healthcare or senior care, we'd really love to explore how we might partner. And if you're an investor or connected to a few, we're currently raising a round, so we'd love an intro. And most importantly, if you're an older adult, a healthcare professional, or family caregiver, you should know that AskSAMIE is help when you need it, like Care GPS. With us, you never left wondering which way to go. I look forward to talking to you later.
Excellent. Thank you, Brandy. So the next company is Consusis, and Susanna Vastag is here.
Yeah, thanks. Hi, I'm Susanna, co-founder and CEO of Consusis. We have deployed a screening tool for sleep apnea. It runs on your phone or your laptop and creates an individual risk profiling in less than 10 seconds. Why does this matter? This is my co-founder's mom, a strong, dynamic woman. She was reduced to a confused, scared ER patient because she had lived with undiagnosed sleep apnea so long that low blood oxygen had permanently damaged her heart. And she left the hospital with a pacemaker and a CPAP machine. Globally, 80% of 1 billion people suffering from sleep apnea are undiagnosed, and the US economy alone is impacted by a burden of $150 billion annually. But why are people undiagnosed? Because the current diagnostic flow is slow, expensive, and relies on an overnight sleep study that offers very limited access and resources. Our solution is now going into trials within 2 major engagements covering 10 million people. With the Barcelona Health Hub, we validate a 50% improvement in diagnostic efficiency using our tool. We cut down the false positive rate, generating an economic benefit of 400 euros per patient. And we are preparing a similar study in partnership with Marshall Medical School. The problem is huge. With rising incidence of obesity at advanced age, the number of people having sleep apnea is permanently increasing. And we are not struggling to get healthcare networks to work with us and to provide a solution. And with that, we are targeting a $3 billion market in the US and in Europe. Damir, my co-founder and CTO, has deep expertise in computer vision and AI and startup experience with multiple exits. My 25 years in healthcare and dentistry taught me strong links between craniofacial and airway features and sleep apnea. And we have Liliana on board, who is an expert in the airway and dental sleep medicine space. We are raising 500K in sales on a rolling close. This will take us through our trials with Hospital San Pau in Barcelona and the Marshall Health Network. Sleep apnea is a health issue that affects all of us, directly or indirectly. We would love to talk to you more about how we can work together to bring the planet a good night's sleep. Thank you.
Thanks, Susanna. Excellent. Okay, next we have Enrichly with Margot Jordan.
Hello, I'm Margot, founder of Enrichly, and we're transforming potential into performance. Next slide. Youth violence, low academic performance, and poor mental health have one common denominator, and that is low self-esteem. Next slide. Now, what if I told you that 75% of children suffer from low self-esteem? And this is not just a problem for children because it often follows them into adulthood. It impacts their career prospects, their mental well-being, and the relationships that they form. Next slide. Now, this translates to a massive social and economic burden that's costing organizations billions. Because healthcare is suffering rising mental health costs, school systems are having low academic performance, and corporations suffer from unproductive workforces. Next slide. Enrichly is changing that with our platform as a service, and we're delivering self-esteem development at scale. We're integrating AI, gamification, and data to effectively improve self-esteem in a holistic way. Next slide. So we've generated over 2 million in revenue to date across healthcare, education, and workforce verticals. And we've proven that there is a demand for improving self-esteem development. Next slide. We're tapping into a $60 billion industry across verticals that we've already penetrated. And we've actually just secured funding from the American Heart Association to expand our platform and our impact across districts in Houston and LA. Next slide. I've put together an amazing team with a combined 50 years of relevant experience to make sure that this technology is both effective and impactful in global markets. So if you're looking to make a huge impact across healthcare, education, and workforce verticals through self-esteem development, contact me after this presentation. I'd love to show you how.
Great. Thank you. Next, we have Humanate Digital with Carlos Rodriguez.
Yeah, good afternoon. My name is Carlos Rodriguez, and I'm the CEO and co-founder of Humanate. According to a recent study by the MGMA, which stands for the Medical Group Management Association, the primary challenges they are facing are staffing shortages, administrative tasks such as HIPAA and verification of insurance, and the ability to schedule patients when they need to be seen. Our agentic AI solutions address all three challenges. Our AI assistance provides bias and judgment-free patient intake, customized digital forms that seamlessly complete by the patient, and convenient self-scheduling for patients. Join us in the break room today for an exclusive preview of our AI agents in action with full video and sound. Let me share with you a deeply personal story. The man you see here to my right is my father. Standing beside him is my mom and my two redheaded boys. He lost his life due to a medical miscommunication error. My father immigrated to America from Spain at 28 years of age, but never really fully mastered English. When he began experiencing prostate issues, he struggled to communicate with his primary care physician as to his symptoms, a crucial detail that never made it into his medical records. By the time I was able to get him into MD Anderson, it was way too late, as he was not referred to a urology specialist in time. His story is one of countless others, a reminder of how critical it is to have unbiased and clear communication in healthcare. One of Humanate's greatest strengths is our team. We're not tech bros. We are former healthcare professionals solving healthcare problems. With over 60 years of combined experience as healthcare operators, our CMO is a Mayo-trained physician, and our CTO holds 24 patents that have generated over $750 million in revenue. We know the pain points firsthand, and we're building solutions to fix them. One last thing, we have been accepted into NVIDIA's Inception program and have been authorized to use the co-marketing line brought to life by NVIDIA. The artificial intelligence healthcare market is growing at a compounded annual growth rate of 49%, projected to reach $164 billion by 2030. We are scheduled to raise a seed round of $10.5 million. We are projecting $2.4 million in sales in 2025, break even by 2026, and $100 million in the next 4 years. The majority of this money will be used to scale up our revenues. We need to develop additional APIs to reach more customers. Thank you for your time. Hope to see you in the breakout room to discuss this opportunity further.
Great. Thanks, Carlos. Excellent. Next, we have knowRX Health, and David Franklin will walk us through it.
Yeah, thank you. I'm David Franklin, founder and CEO of knowRX Health. We started shortly after I lost my father due to a medication side effect in the ICU. Since then, I have gathered a team of academic PhDs, PharmD, pharmacists, nutritionists, physicians, and technologists. So what is the problem we see today? Today, we know that EMRs only capture data from when you visit a provider at their clinic. They lack real-world evidence that prevents early interventions and proactive care by these clinicians. And also today, as a fee-for-service ecosystem, healthcare systems are not profitable. This is why we need to make a change. Next. So how do we turn it around? At knowRX, we're leveraging real-world data and evidence to transform into real-world care. We believe that real-world evidence will drive value-based care, increase healthcare providers' efficiency and their revenue, and it empowers both the clinician and the patients in this ecosystem. Next. But why now? As we understand it, there's a growing marketplace on the consumer side through FDA-approved applications and devices that we have accessible to us. Also, CMS is expanding their reimbursements into real-world data and evidence, and regulatory is pushing beyond fee-for-service into value-based care, like with the Cures Act. Next slide. The market size is quite large, but right now we're solely focused on women's health and menopause and diabetes. There are strategic engagements with the Mayo Clinic and Johns Hopkins. Next. We have two products, the OWL app, which is a consumer mobile application, and then PICS, a portable information exchange web portal for clinicians and providers. Simply here, a patient can download the application and start gathering their medical information through prescriptions management, health education, in-home labs that we provide, and vitals through connected devices or wearable devices. That generates a consumer health record. And also, we generate care plans. This is a patent pending solution that we have a provisional patent on. That information is exchanged through a blockchain smart contract, creating a sealed consumer health record made available to clinicians and pharmacists where they can reply to patients and generate new revenue opportunities. Next. Our business model is B2B2C. We are currently engaged with the Mayo Clinic on a menopause study, and they are one of our investors, as well as we generated revenue from Johnson & Johnson. We also have a letter of intent with the American Heart Association for a cardiovascular pilot, and we currently work with multiple physician organizations and partners throughout the U.S. Next slide. Thank you for this time today, and I look forward to talking to you in our breakout sessions.
Okay, great. Thank you. Next, we have MatchRite Care, and Chris Jones will be giving us the information about that.
Thanks. Hi, my name is Chris Jones, the founder of MatchRite Care. MatchRite Care is a patient record sharing application allowing patients to transfer records more conveniently between provider and provider. Next slide. And we know how important this exchange is. I do understand that personally. In 2009, I had a son diagnosed with a brain tumor. Given 1 year to live, we missed a clinical trial because we didn't get his medical records in time. Looking back on that, we don't know if that trial would have helped him, but the opportunity for not getting that trial was a pain point that stuck with me to this day, and which pushed us to create this platform called MatchRite. And even after 2009, we're having the same problems we had before, is that there's still scattered records. There's no way to get one single access point to your records. There are care delays and efficiency in care because you don't have a complete view of who that patient is. And I understood by just building MatchRite, putting patient in mind was the most efficient way to fix that. Next slide. So what did we do? We created a common data model. And what that means is that we looked at all the EMRs, all the electronic medical records, and every health system, whether it's urban area, whether it's a rural area, or whether it's just a loved one someone taking care of their loved one. It was important that there was a common data model that the patient could understand that no matter where that record came from, when it comes to our system, how do we create a common data model for the patient or the caregiver that's looking at that? Next slide. And what MatchRite key features beyond the common data model is what we did. We wanted to create a universal access. No matter where you're located, anywhere, any place, or any time, you should be able to access your records. And not just have access to it, but actually control those records. And one barrier we tried to avoid is we tried to stay outside the federal interoperability networks. We could create our own network behind our own systems that allow patients now to move freely, agnostically between systems. And that allows us to put our AI-generated health summaries on top of that, so patients not only have the records, they can get decisions on those records through our common data model. Next slide. And we didn't just start this. Over the last 6 years, we've been working heavily on building this common data model. So as you see here, we connect with multiple EMR systems, whether they're connected with rural systems or urban systems. To us, it didn't matter. For the patient to have access to the records, they shouldn't have to worry about the technology. They should just worry about where the records are located and being able to go get that. And we focus on is combining all those medical records, no matter where those records came from. It's just spit out in our common data model that we have here. Next slide. And our revenue opportunities extended beyond this common data model that we have. The patient are now walking around a lot of information in this unique data model. And what we've learned is that there's 4 different ways we can generate revenue. One is for most profitable way that we see now is interacting with third-party applications. What this means is there's a third-party app that needs to have historical data from a patient, just like you plug into your Fitbit into another app. MatchRite operates in the same way. It also helps with clinical trials and pharmas looking for recruitment for patients. Because we do have AI on top of our common data model across our patients, we can identify patients for clinical trials or pharma based on some of the procedures they had or medications that they're on. We can do that as well. And we have a provider exchange between health systems, the patient to provider. We have that exchange as well, that the patients now can share their records directly with doctors. Next slide. And we did just start this again. We have a large team, and these are 4 of the key people that's in our team now that expand over 25 years in healthcare space. ranging from regulation to healthcare, from building startups, and also from the patient engagement side. And so where our focus is to make sure that patients have access whenever they need it. And we're growing our platform out now. We're looking to do a capital raise now. We're also looking to be connected with those 4 revenue opportunities. So if you know anybody that's interested in connecting us with a third-party app or connects us with a health system, we're looking forward to talk to you. Thanks.
Hello. all.
Okay, great. Thank you.
Yeah.
We next have MobilityZ, Sichana Patel. Is going to talk us about that.
Hello all. I'm Sichana Patel, a CEO and founder of MobilityZ Health. Next slide. So I built this company from my experience with musculoskeletal injuries. I bet most of you must have faced musculoskeletal injuries at some point in your life. So as a researcher and an engineer and a basketball player, I was doing repetitive motions for a decade. And one fine day, musculoskeletal injuries occurred in my hand and wrist. It also obstructed my productivity, my work, my play, and also my career to become an astronaut. Next slide. So as I lost 25% functioning of my hand to musculoskeletal injuries, I wanted to dig in deeper to see how many people get affected. Turns out there are 124 million people who get affected by musculoskeletal injuries, but there are only 22K doctors who can take care of them, considering the orthopedics specialist is required for the diagnosis. I partnered with one of the orthopedic surgeons and realized that 2,000 plus patients wait in line to be seen by an orthopedic surgeon. And 60% patients that they see right now are not to be seen by orthopedic surgeon. They could be taken care by other specialties of like chiropractor or a non-surgical orthopedic care. Turns out 45% burnout of orthopedic surgeons is due to this crowd that is currently in their clinics. Hence, we decided to build a solution. Next slide. So our solution comprises of how the orthopedic surgeon can manage their clinic well, wherein they can remotely triage the patients, they can remotely monitor the patients, as well as it helps them in the workflow efficiency, patient retention, it reduces their burnout, and it saves their time. This is a technology wherein from the camera of their phone with an advanced telehealth methodology and computer vision embedding, they can triage this patient and monitor them from their clinics. Next slide. This particular technology opens an opportunity for $340 billion market. MSK is a $69 billion market in US, which is on the path of increasing to $200 billion by 2028. Our mission is very focused on reducing healthcare cost, which is $329 billion, and reducing $169 billion of injury claims. Next slide. With an exemplary team, me and my CTO who has an acquisition experience and a clinician who have 25 plus experience in orthopedic surgery, we cumulatively have 140 years of experience, and we are working on the tranches that leads us to the traction. Next slide. Of locking some LOIs from orthopedic surgeons, emergency care, and primary care doctors. We have also have LOIs from the employers. We have patent protected technology and international recognition. We are also selected by NASA for space health technology and published our paper there. We have launched our app, which is HIPAA compliant, and we currently are working with a 500-bed hospital to complete our clinical validation study. We are operationalized to serve our first paying customers and having partnered with some big names in the industry like NVIDIA, Google Cloud, GitHub, AWS, and Plug and Play. We are supported by entrepreneurial programs and backed by Techstars, Jumpstart, Foundry, Texas Tech University, Founders Institute, and Enrichly. Next slide. So if you are here to invest, we would like welcome the opportunity to have a conversation. We are raising a 1.5 mil round, and whoever thinks that there is a potential partnership or would like to work with us, please feel free to connect with me. And the information is in the QR code and the email. Thank you.
Great, good job. Well, thank you. Next, we have Ovum Health, and Alice will give us the description of that.
Ovum Health is both a precision medicine platform and a provider network biohacking fertility. We are improving fertility rates while also decreasing adverse pregnancy outcomes. My name is Alice Creasy. I'm co-founder and CEO. I'm also a cancer survivor. I endured 9 pregnancy losses and 5 rounds of IVF to have my one miracle. No one could tell me why I was failing to give him a sibling. And 12 million people today are dealing with the same heartbreak. Chronic illness is a crisis facing reproductive age Americans today. And in fact, the same conditions driving infertility are also driving adverse pregnancy outcomes like gestational diabetes, preeclampsia, preterm birth, and even maternal death. And yet, these are preventable outcomes. That's why we have a proprietary molecular diagnostic platform, gets to the root cause of disease. We upskilled all of our OB-GYNs and fertility specialists with lifestyle medicine to truly tailor a personalized treatment plan that improves health at the cellular level. We also support behavioral change, both high tech with AI-powered coaching and high touch with an incredible care team. We do this through a fee-for-service business model. And in fact, we have 60 million insured lives under contract already. We accomplished that in less than a year. And that's 10 times more than Progeny, who's our largest competitor. They extraordinarily already produce $1 billion in revenue per year. And that's done with only 1.33% utilization rate of their program. We have about $17,000 in revenue reimbursed per baby, and we operate at a 50% contribution margin. We have 48 CPT codes that are already covered under our insurance contracts. We are taking advantage of a growing telemedicine space that's growing at a rapid 19% CAGR. Stunningly, 72,000 babies of the 3.5 million babies born per year are considered the fertility market, which is another $5 billion. We have a mobile app acquisition channel, also proprietary technology, that can help us bring 12,000 ovum babies into the world and generate $200 million in revenue. My team has done this before. We've exited 3 times collectively, published hundreds of papers. We've helped change a dozen healthcare laws. We've all come from the biggest brands in fertility, and through our careers, brought 150,000 babies into the world. We are raising a $2 million seed, looking for early stage investors who want to help us become market dominant in these 14 states that we are already active in. Future pregnant moms, thank you. Please contact me at the email below.
Great. Thanks, Alice. Exciting stuff. Okay, we have next 2 more to go. We have Pills to Me next. Leslie will talk us through it.
Hi, everyone. My name is Leslie. I am a pharmacist, founder, and CEO of Pills to Me. Next. So at Pills to Me, our goal is to increase medication adherence, especially in vulnerable populations, by removing the various barriers to care. Next. And a lot of people don't know this, but more than 30% of prescriptions filled in pharmacies across the US every day are not being picked up. And that's about 1.3 billion prescriptions every single year. And the reasons range from people who can't drive or don't have reliable transportation, to people that are too sick to get to the pharmacy, and others that are just so busy with everyday life. So next slide. So we built HIPAA compliant technology, mobile app, and a suite of other software that patients, physicians, and caregivers can use to order for their loved ones' prescriptions to be delivered from any pharmacy in minutes. Next. And our job doesn't just end when we hand over medications to patients. We also offer medication therapy management services, where a pharmacist connects with the patient once a month to make sure they're on the right medications for the right reasons. And MTM is reimbursed by Medicare Part D. Next. So we've delivered over 1 million prescriptions. We're currently doing more than $70,000 a month in monthly recurring revenue, and we're live in 11 cities. And we're currently on track to start doing a nationwide rollout in Q2 of this year. So our business model is simple. We charge $9.99 per delivery or through a subscription model, and we get reimbursed at least $45 per patient per month for MTM. Next. So here's our founding team. Myself, I'm a pharmacist with more than a decade of software and entrepreneurship experience. We have Tama, our CTO, who has almost 2 decades of software development experience, and also a host of other team members. Thank you.
Great. Thanks, Leslie. And then last, we have Rif Care with Val.
Hi, my name is Val. I'm the co-founder and CEO of Rif Care. Rif Care is an innovative period care company that makes hormone-safe solutions. My co-founder, Rebecca, and I started Rif because in our early 20s, we suffered miscarriages and hormone health issues. There's a growing awareness of the toxins in personal care products, from heavy metals found in tampons to PFA forever chemicals in underwear. People feel like there are no safe options. The menstrual care market is a $43 billion industry annually. The global feminine care market is anticipated to grow to $73 billion by 2032, with an average category average growth rate of 7%. Millions of women are suffering with menstrual disorders, and we're here to help. Rif Care makes hormone and planet-friendly products for better cycles. We're the first company to launch hemp fiber pads onto the market. We use hemp because it's high-performing, super absorbent, naturally antibacterial, antimicrobial, and it's a carbon sequestering plant. We have 3 core products that you see here: hemp fiber menstrual pads, hemp fiber period underwear, and organic cotton tampons. Our products stand out because we use innovative ingredients to ensure that they're more high-performing and comfortable compared to conventional products. Next slide. We've experienced explosive growth. In the past 52 weeks, our retail sales have grown by 85% with a healthy 30% margin. We launched with Erewhon in June of 2022 and have maintained a #1 spot in the category there for over 2 years, and we're now in over 200 retail locations. Our direct-to-consumer sales are where we see the biggest opportunities for growth and the biggest margin at around 60 to 70%. We increased sales by 50% last year online with a customer acquisition cost of $17. We expect the lifetime value of our average consumer to spend about $4,500 over a lifetime. And we know this amount can increase as we expand our product lines to support women's entire cycles. Next slide. This year, we're projected to reach $1 million in revenue by the end of 2025. We'll do this by launching into 1,000 new retail locations, growing our online presence, and also expanding onto the West Coast and Midwest retailers. We'll grow our online sales by increasing our email list subscribers to 100,000 subscribers through the launch of a new ebook, which we just finished this week, improving our conversion rates online to 3%, and also by running retargeting campaigns and boosting our customer loyalty program, which will improve our returning customer rate that's currently at 45% to 75%. Next slide. Rif Care is building influence with over 30,000 women in our community. I was a former influencer marketing strategist, and that's given us really a leg up when it comes to social media strategy. Next slide. We have an amazing team. My co-founder, Rebecca, is a scientist, and we just brought on the founders of Monday Swimwear, Natasha Oakley and Devin Brugman, as our new investors and partners. Their expertise in running a $50 million a year fashion brand is going to help us grow. Next slide. We've already raised half of our $500,000 bridge round, and we're currently seeking $250,000 from angels and strategic investors to help close this round and make all of these plans a reality. We'll become a brand that helps women in all stages of their life, from menstruation to motherhood. If you'd like more information, please just take a picture of this screen, and thank you so much for watching this. I look forward to connecting.
Great. Thanks, Val.